Like many of you, I am passionate both about education, about building people's skill capacity, and about care for people who are living on the margins of society. As the sun would go down each evening, the fighting would start. There'd be explosions in the distance, gunfire. For this reason, I always had my doors shut up before sundown. So one particular evening, the kids were in bed, it was about 10 p.m., and suddenly a loud crash, 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 and I saw a young man with a rifle smashing its butt against the front door. But he wasn't alone. Instead, there were 20 other soldiers in the front yard with the truck parked on the street. Following completion of my formal education, I was on location in Angola, a nation in southern Africa, a nation suffering from a brutal civil war. In that context, I had been invited by churches to help them establish medical clinics. One day, a woman brought her 5-year-old boy to me. He was urinating blood. I thought that this was probably a bladder infection like we commonly see in the United States. So I went to my mentor, Andreas Rohner, and Rohner rolled his eyes. He looked back at me and he said, "Didn't you go to tropical medicine school?" "Yes." "Didn't you study schistosomiasis?" "Yes." Well, sure enough, I examined this child's urine and I saw the schistosome eggs. Tropical medicine school at Walter Reed at that time was months of studying exotic diseases like schisto that affects 200 million children around the world. But when I actually saw a child suffering from that disease, I was utterly unable to apply what I had learned in the classroom to a practical situation. We see the same phenomenon throughout education. We have music students who cannot perform. We have composition students who rarely publish. We have language students who cannot engage in conversation. What is the missing element? Often it is practical, real-life experience, ideally in the presence of a dedicated mentor. The pounding continued. I was certain that they were going to come in one way or another, whether I opened that door or not. And so I went to the latch and relented, expecting the worst. But rather than a flood of soldiers pouring into my house, there was a pause, and an officer walked in. "My name is Job," he said. "May I have a seat?" My heart was pounding in my chest. Of course you can have a seat. Today, I lead the Institute for International Medicine, a global health training organization whose purpose is to equip inspired individuals with the practical skills that they need. Our students study online and in classroom the principles of international public health, of disaster management, of diseases of poverty, but we require them to move on to an actual service learning experience with one of our mentors on site in one of 25 developing nations around the world. Mentors like Andreas Rohner. What's the implication for we as educators? We need to encourage our music students to perform at every opportunity, encourage our composition students to publish their works, work with our language students to engage in an international conversation every day. By parallel, students take advantage of those opportunities to publish online, to blog your compositions, to engage internationals in real-life conversations, to perform your music in places where people will enjoy hearing you perform. What will the result be of applied education? The main outcome is development of good judgment, the kind of judgment that can only result from experience. He found a couch and he made himself comfortable, looked across the room at me. I want you to know that we're fully aware of the good that you're doing for our people. I've instructed my soldiers to be watching out for you. You may not see them, but they will be protecting you in ways that you will never know. As he stood up to leave, he looked back at me and he said, "By the way, my sister brought her 5-year-old son to see you. He was urinating blood. She had already taken him to several other practitioners, but the bleeding continued. But after your treatment, the bleeding stopped."
Please welcome to center stage, receiving the Alumnus of the Year Award from the School of Medicine, Dr. Nicholas Comninellis.
I believe in the power of exceptional role models. Find one, become one, and then inspire another one.